We are starting with a health update as many people are concerned hearing that a South Carolina student who is in Hartsville just about an hour ago from Columbia tested positive for tuberculosis.
And now News 19's Walker Lawson is giving us some more details on the infection and what your family needs to know tonight.
The risk to the general public is very low. And so it's not something that those of us who live in South Carolina need to actively be concerned about.
Health officials are urging the public to stay calm, reminding people that while tuberculosis can sound scary, it is rare in the United States.
We don't vaccinate against tuberculosis in the United States because of what I said before. It's not actively transmitted in our country. On an ongoing basis. Now, in other countries where TB is very common, they do use a vaccine to reduce risk. We don't use it here because we don't need to.
The South Carolina Department of Public Health is investigating the confirmed case linked to Hartsville High School and working to identify potential exposures. Tuberculosis, also known as TB, transmits through close, prolonged contact, such as talking, coughing, or sneezing near someone, but it cannot be spread by sharing food or drinks.
How often are you close to that person, and for how long are you close to that person? So it's not passing somebody in the street. You're not going to get TB that way. It's somebody you spend some time with.
Symptoms of the bacterial infection include a persistent cough, sometimes with blood, lasting 3 weeks or more, unexplained weight loss, night sweats, and fatigue. Dr. Emilio Perez, an infectious disease specialist at Lexington Medical Center, says South Carolina sees 80 to 90 cases per year. And while there are effective treatments, the recovery process takes time.
So, I mean, the treatment is long. Okay, we treat, up to 9 months in some cases, even longer if it affects the brain or other parts. But it's a very long treatment and requires several antibiotics.
Both Dr. Perez and Dr. Buchanan say they are more concerned about the spread of different flu strains in the state than tuberculosis. Walker Lawson, News 19, WLTX.
Walker, thank you so much. And as for the case over in Hartsville, health leaders say a small group of individuals outside the school but connected through transportation are also being contacted for testing. So a lot more updates to come.
But again, doctors say it has to be prolonged exposure and you can't catch it just from simply walking past somebody on the street. We hope